Hey class, that's Doug Brown. Welcome to our new term. I want to take a moment and say welcome to Public Health Hazards Planning. I'm excited to have an opportunity to work with each of you this term. We'll be together in the next 8 weeks, finish out and around Christmas time, somewhere in there close. We'll discuss different plans involved with public health, disasters, emergency management. We'll discuss some of those different hazards, developing plans, etc. What are we doing this week? What I'd like to do first, if you haven't checked in and read the syllabus, looked over the class, please make sure you do that. It's important that you read the syllabus, the grading scale, the posting requirements, including supporting your work with in-text citations and references following APA. And turning your work in on time. Make sure that you read the late policy. However, if there's an emergency, something happens at work, you have to work overtime, something else comes up, just let me know and I'll do my best to work with you as much as possible. I know things happen, but I want you to try to get your work in on time whenever possible. So what are we doing this week aside from the introductions? Again, I'd like for you to jump in, share some thoughts about yourself, where you're from, why you're taking a class, any experiences that you may have with public health disasters or planning. Some of you have already done that, and I appreciate you doing that. Our first assignment, what are we doing this week? We will discuss the fundamentals of health public health programs. A lot of public health programs out there. Some of you may be familiar with those. Some have changed up. Everything from, getting shots. When I was a kid, that's where you went to get your shots, was at the health department, part of that public health planning. That's changed a little bit now, although some states still offer TB testing, etc. Public health is important. Those programs are important, not just going to your physician, but getting that public health service so that the Department of Health, Human Services, etc., can identify potential risk and hazards such as TB, such as influenza, Ebola, some of those things that do happen, those different hazards that we do face. Obviously, we don't have a big issue with Ebola here, but it does happen. We've had some patients come into the United States for treatment. So that's important of importance of some of those different public health programs, sort of syndromic surveillance, so that we can capture that information, find out what's going on, find out what is endemic. If there is a pandemic that's likely to occur, such as with influenza. And when I talk about things that are endemic, there's parts of the country where certain diseases are prevalent, they just occur there. For instance, we're seeing some of the outbreak with encephalitis secondary to mosquito bites in Massachusetts right now, the mosquito being the vector carrying that disease and biting people, and then the after effects that we have secondary to the disease carrying mosquitoes, and then we get encephalitis. There's some injuries there. Interesting enough, in the South, growing up on a farm where there's cotton and rice and it's wet all the time, it's just mosquitoes, millions and trillions of mosquitoes here, and it's not really a big factor. We've never really had a big outbreak back in the day, Civil War times and before. There was always that chance of malaria, something that we've pretty much gotten rid of. Lately, the last 10 years or so, it's been outbreaks of West Nile virus, but even that's a small percentage. But those are some of the things that the reasons that we have those public health programs, the importance of them, and then we capture the data from those different outbreaks as part of that syndromic surveillance. Some of that comes from physicians' offices, etc. And then the health departments, through epidemiologists, can determine whether or not they believe a pandemic is going to occur, or there could be something, an outbreak in that particular case. Some of the specific health programs in Massachusetts, I want you to take a look at those, if you will. If you live in another state, I know some of you may be in another state, so feel free to alter that a little bit, share some of the public health programs in your own own state, your own region, your own district or community. It's okay to do that. That don't just have to be Massachusetts. Obviously, if you live in Massachusetts, share that. Otherwise, pick something in your local community, and it's okay to do that. That's absolutely fine. Also, describe and examine the public health websites and links. It's important to know where you can get information. Those are tools for your toolboxes. Some of you in the class have some experience in reading your introductions today. I see that. Some of you may not, so feel free to share some of that information that you may have, if you can, about some of those websites and links where we can learn more about public health programs, not just the U.S. Public Health Service, but something locally, statewide, anything that you may have, and discuss that. Again, it's great to have those different tools in your tools box, especially when you're developing plans and involved in public health emergency management and disaster planning. And there's different definitions that we'll discuss. In this case, infectious diseases. A lot of diseases out there that infect the human as well as other animal, other species. Some of that can be crossed over to humans. Some of it cannot. For example, monkeypox. Monkeypox is one of those things that there was an outbreak of that a number of years ago up in Minnesota, Kansas, somewhere up in the Midwest anyway, where people were keeping prairie dogs as pets. And you would think with monkeypox, it'd be something that we're getting because we're keeping monkeys as pets. In this case, it was infectious diseases that occurred because we were keeping prairie dogs, and that's something that they carry as monkeypox, and that's transferable or transmitted to humans, unlike some of those infectious diseases, HIV, Marburg, and Ebola. Some of the big ones just to think of, just a few. And so just keep that in mind. Some of those infectious diseases are not easily transmitted to humans. They remain in some of those other species, subspecies, versus mankind. So take a look at those if you don't mind. Some of the websites, again, National Public Health Service. Just look at those a little bit if you don't mind. Our discussion this week, again, introduction, and then we'll discuss a little bit some of those different threats and risk. In our discussion this week, one of the things we talk about is risk. Webster's Dictionary defines risk just in its basic form. It can be expanded. Risk meaning several different things, but in its basic form, the word simply means that we are or may be exposed to a hazard or danger, something that can affect us, whether it's an injury or in this case an infectious disease, something that we can be infected or hurt by, contract, that will affect not only us but can affect the public health. And if you remember that some time ago, this has been a number of years, but HIV was the big thing. I know when I started in EMS, HIV was a big thing, and at first no one wore gloves. Then we started wearing gloves, and we started wearing full protection, personal protective equipment, so that we could protect ourselves, because we didn't know a lot about it. And then as we learned later on, even with the needle stick, there's less than a 1% chance that you will contract anything like HIV. Just because that's how the factors are, but we're still at risk for contracting that based upon those different factors that are involved in how it's transmitted. So make sure you take a look at that. Let's talk a little bit about, I included some videos on there I'd like for you to watch. They may be helpful. We'll talk a little bit about APA. Students often get frustrated with APA. I require APA in the discussions and the papers. You should see some examples. I believe I posted some examples. Let me look. Stand by just a moment. I believe I posted some examples in the announcements to help you, the discussion board example, and I will also post a template for you on the paper I'd like for you to consider using. Don't stress about it. I want you just try, do the best you can. We're going to get there. I'm going to work with you, give you feedback to help you, as well as some examples. So if you're not familiar with APA, don't stress about it. A word of caution. Microsoft Word and some other programs have some options for you to add citations and references. I'd encourage you to learn those your own. Don't count on the program to do it. They don't always get them right. They're close, but they're not always right. For example, something may need to be capitalized in the program in Word, it doesn't do it. Or it's not capitalized and Word does it. So I'd encourage you to you look at the OWL at Purdue, look at some of the different links that I'm going to share with you to help you with your APA as we move forward. I want you to take your time. I don't want you to get in a hurry and try to write your discussions, try to write your papers in a hurry. I want you to take your time, read the material, look at those examples and links that I give you before you get started, so that you don't have to go back and do it again, or as we get into week 2. Now, first couple weeks, I'm usually pretty lenient on the discussions of the papers, give you that feedback, try to help you as we move forward. But as we get into week 3, then I start deducting some of those points for not including those in-text citations and references following APA. I do give credit for trying. Now, obviously, in week 1, if you're doing something one way and then in week 8 you're still doing it the same way, well, we need to have a discussion. So we'll do that as we cross that path as we need to. But I'm certainly going to move mountains and do everything that I can do to help you. And looking at the roster, a few of you have had me in classes before. You know that I require a lot. But you also will find, you will find that I require a lot, but you will also find that I will give you a lot. While you're giving 110%, I'm trying to give you a 500% to help you learn the material, help you learn how to write APA, site, etc. So don't stress on it. Just hang with me. I think you're going to enjoy the class. We're going to enjoy the class together. It's going to be some work, but we're going to enjoy the class. We're going to learn about public health hazards, some of the different things that I've worked on in the past, and working in healthcare emergency management, some of the disasters, pandemics, and hurricanes and things that I've had an opportunity to work with, doing exercises and drills and writing new papers and books and different things. So I hope you enjoy the class. Now, here's what I want you to do. Program my phone number and email in your phone contact information, and I want you to reach out to me anytime you need me. I work 7 days a week, holidays, nights, whatever. So feel free to call me if you need me, and I'll do everything I can to help you enjoy the class and learn. So thanks for dropping by. A little quick, thanks for dropping by. If you ever need me, let me know. We can meet face-to-face on Zoom, Skype, whatever we need to do, and I'll do everything I can to help you. So here's to a great term. Keep rocking. I look forward to working with you, and thanks for taking time to watch the video.